So this is just our foundations course. This is how we kind of just introduce you to Theragun and bring you enough information, like I said, to try to help you understand where we came from. So just to give you a backstory on the origins of Theragun, it was born out of necessity. Our founder and inventor, Dr. Jason Wersland, is going to just share his story, but he always says that necessity is the mother of invention, and you'll find out why he says that here in just a second. Let's see if I can get this to play.
They say necessity is the mother of invention, and my need at that time was, in 2007, I was getting ready to go to one of my last exams at chiropractic school. And I jumped on my bike and I was splitting traffic, and a car realized that it was going the wrong direction and cut me off on the freeway. And I was going 55 splitting traffic, and I slammed in the side of this car. My soft tissue damage really didn't set in until Christmas of that year. And I just started a practice with a buddy of mine here in LA. I was stuck and I was in pain. I didn't care what this thing was that was going to fix me. I just wanted the pain to go away. Sitting in my apartment, and I thought, you know what? I need something stronger. I need something that just punches that area. And just by me sort of thinking that, I thought, I have a tool out there. I could probably make one. Went out and I grabbed 2 or 3 tools and I brought them in and I set them on my coffee table. And I just started messing around with it. And I found that this thing worked. I could suddenly now get in the shower for 10 or 15 minutes and do what I needed to. I could eat. I hadn't slept for over 40 days at this time, a solid night's sleep from pain, using it for pain, and then using it for rehab, and then using it for helping my muscles build over time. Not understanding really, but I was sort of the first patient. And with my education as a chiropractor, and then applying the science to myself, I didn't realize it, but this was being ingrained into my knowledge about what this does. Over time, between 2008 and 2011, I created 4 different versions of the same technology. And I felt an enormous obligation to figure this out, to find out why this was working. In 2011, I created what was my first real tool that I'd taken apart, welded pieces on, put them back together on a larger scale. I did 250 of them. In 2014, I flew to Boston and met the New England Patriots in their hotel before the preseason. And the guy that called me said, hey, just bring as many as you can bring. And I could bring 22. I fit them in these 2 bags, carry-on bags, showed up at the hotel, unzipped these bags. As fast as I could take cash and hand out a Theragun, I was handing out a Theragun. I ended up taking it with me on the road. I treated a bunch of NASCAR guys. I treated other professional athletes with this crazy thing, just sort of dabbling it into my normal treatments. I consider it a mission of mine to make sure that everyone that even is interested in a product like this understands what I've gone through as a clinician, what I've gone through as sort of the developer of this product, and we've done as a company. I have dozens of physicians, body workers, physical therapists, chiropractors around the world who say to me, this changed the way I practice. For you to be able to have something you can reach out to, grab a hold of, fix yourself, take away the pain, increase your range of motion, give you better activities in daily living, spend more time with your kids, grandkids, hiking, whatever it is. That's literally what we're trying to do. There's 3 things that I learned through this process that makes this work. And it's frequency, amplitude, and torque. And the combination of those 3 things is what Theragun offers that makes it so special. We have 12 years of experience. What we want is for people to feel trust in this product. To trust the product, you have to have education. You have to know what this is. And to be able to understand what this is, you have to go with someone that knows what they're talking about. And there's no one that knows better what they're talking about, quite frankly, than Theragun and myself, because I've been doing this longer than anyone I know, anyone I've met. I've been to a lot of places on this earth. Where we're at today with the G3 Pro, G3, and the Live is way beyond what I could have ever imagined. I think it's really important that people understand that, that first product was a representation of desperation. Like I needed something and I didn't care what it was. Theragun's future is to continue along the path that we are now. We are driven by science and research, education. We're constantly innovating. Our goal is to keep people pain-free and keep people moving. And the last time I checked, we're not in every hand in the world, so we got a lot of work to do.
So cool, right? Every time I see that, I think Ash will agree with me. Every time we hear it out of his mouth, it's so impactful. I don't know a founder of any other company of this type that gets that emotional over their product. And so hopefully you can see how the whole point of him coming up with Theragun was to help. And he found help, and then he wants to help other people. So Theragun is very much about education and teaching people understanding. So cool, so cool. So we're going to talk a little bit about percussive therapy. So most of you as massage therapists understand that what we do in massage, percussion-wise, is hacking and this kind of stuff and our cupping, right? Most of you have learned those techniques through massage therapy. This is a little bit different direction, same concept, but we're using a tool instead. I don't know about the rest of you, but personally, getting a massage and having somebody do that on my muscles didn't ever feel good to me, and I didn't ever like to do that as a massage therapist, although I understood the benefit. And so when Theragun came along, when I started using it, I thought, oh, here's a great way to give the benefit of this without me having to do that. I always felt like it was uncomfortable on my wrists and my hands, and it gave the client a little bit something more. So Theragun percussive therapy is basically for anybody. We try to spread that message that there's not a person on earth. If you exist, I tell people, if you exist, it's for you. It's a deep muscle treatment, and it uses rapid, long vertical strokes to get deep into that muscle tissue. And we're also creating a neuromuscular response at the same time. So a lot of the tools on the market today incorporate vibration, which we know it means going back and forth. Theragun has found a really optimal level of going vertically into the muscle tissue, and we'll get into that a little bit more. Again, please guys, if you have questions as we go along, feel free to just pop them up there. Ash will keep track of them for us, and we'll make sure we answer them. So just to give you a little bit of more in depth about Dr. Jason, you heard him say there's a combination of three things that make Theragun work at its optimal level, and that's amplitude, frequency, and torque. And we're going to get into those a little bit more in depth, but it's what they've found is the essential triad in order to treat the muscle tissue the way we want and to elicit the response that we expect to get. Okay, so just going into amplitude. Amplitude means the depth and the depth that comes out of the head of the Theragun into the muscle tissue. So we're talking about 16 millimeters of depth, a ½ inch into muscle tissue. So you think about when you're providing maybe a deep tissue type massage and you're wanting to get deeper in the muscle and there's a little bit of resistance from your client. The depth is so much further into that muscle tissue, and will give you the opportunity as a massage therapist to then perform your talents and share your abilities through your hands and your elbows, helping Theragun kind of break through that, getting that deep into the tissue. This is important because the body's nervous system gets a chance to get used to it. So the way that the Theragun is actually touching the body, the attachment itself is actually leaving the tissue surface between every stroke. This is my favorite thing on here. It talks about in that last paragraph, so our brain does what's called accommodation. So if you think about something like, let's say, I usually tell people, let's say I was scratching one spot on your body over and over and over again. It gets a little bit annoying, but you also kind of get used to it, right? So Theragun leaving the skin doesn't allow your brain to process that, and so it's still able to enjoy it as it goes, and you don't get used to it. That accommodation, the best way to relate that to you is to talk about your underwear. As weird as that sounds, we wear our underwear and we're not aware of it. It's just kind of part of our existence and our function. So we're not aware of it. But if you can imagine being aware of your underwear on your body every second of the day, can you imagine how annoying and frustrating that would be? I just think it's a great way to relate that accommodation to you. So frequency. The frequency is the speed, the number of times that the Theragun touches your body in a second or a minute. Okay, so we're talking about, we have a range now of 1,750 percussions per minute up to 2,400 percussions per minute. If you can imagine yourself as a massage therapist being able to do this motion 2,400 times a minute, I can't even imagine what that would feel like on my body. So again, going back to, let's say I poke you in the shoulder for 30 seconds really slowly, say 1 time a second, right? It's easy for your body to understand. So if we speed that up and we can hit your body 80 times per second, that's happening so fast that your nervous system can't tell the difference between the finger poking your skin or resting on the skin. So again, we're back to that, how many times that Theragun hits the surface of your skin and comes off. All right, so a range of 25 times per second to 40 times a second. That's our range of frequency. And they've found through their scientific studies that 25 times per second is really great for relaxation. And then 40 times per second is the perfect speed for pain and tension relief. And then again, we'll talk about that a little bit more. All right, and then torque. So I love this. Imagine a Prius. Most of us know what a Prius is, a small little car pulling a trailer. So the difference between the Prius pulling a trailer and a Ford F-350, if you don't understand those concepts, if you're not a car person, a really big truck and a little tiny car pulling the same trailer. So the Ford F-350 would have much more power pulling that trailer weight to stop, in order to be able to stop the truck, but also the trailer's not going to stop the truck from being able to pull. But the Prius would not be able to pull that trailer. So Theragun has the power you need to get deep in that muscle tissue. So we have what's called stall force. Theragun takes 60 pounds of pressure to stall it out. I'm going to give you just an example. Sorry for the noise, but I just want you to be able to hear how hard I have to press. Well, that's a good deal of my strength pressing into it, and it's not stalling out. And the whole point of that is to say that you're still getting as much power and those same percussions per minute, even if you're applying a significant amount of pressure. I always tell my massage therapists in our course, never will you ever apply 60 pounds of pressure to a client's body using the Theragun. If that's happening, there's probably something wrong there. So the takeaways from that, Theragun percussive therapy has both local and global benefits to your body, okay? The difference here are, the different effects are as follows. So we're gonna activate and mobilize, increase your readiness for an exercise or workout. So looking at this from the flip side of, let's say you have an athlete that you're working on, when you use Theragun in your treatment, you're gonna help them be ready for their exercise or whatever their event might be. Okay, we're going to do, it's got a restorative process, and then there's also relief from muscle tension and pain, and it's going to just kind of restore their well-being. So kind of similar concept to what we want to accomplish in a massage. So here's just a short list of some of the benefits that we found. And again, Theragun strives to do scientific studies as much as possible so that we can have proven outcomes of what we claim. So with benefits, we reduce pain, increase blood flow, break up scar tissue, decrease lactic acid, release muscle spasms, increase lymphatic flow, makes recovery more efficient and effective, activating the GTO, making stretching easier, and improving range of motion and body awareness. So I don't think any of those on that list are anything averse to massage therapy itself, which I think is great. Let's just talk a little bit about the science. I don't want to go too in depth in this because I don't want to just bog your mind down with too much. But there's a history of rubbing sore muscles. If you think back over time, even as yourself, maybe before you were a massage therapist, if you had an injury, if you banged your elbow, the first thing we do is, we rub it, right? To try to help it feel better. So this is kind of that history of starting to massage. We rub and squeeze and we try to do things to alleviate the pain. So again, going back to that local and global effect. So the same concept as rubbing your sore muscle, you're helping that area specifically. And using Theragun percussive therapy, again, frequency, amplitude and torque, we're gonna provide relief for that specific area, that specific muscle group. But it also causes a global effect with different benefits, and we're going to talk about those in just a minute. And those vary with the attachments that you use, the force you apply, and the speed that you move the Theragun. Local effects, again, increased blood flow, oxygenation, transport of metabolites through that area, changes the temperature in the tissue. So when you do a massage, you think about there being heat to that muscle area, myofascial function, and then activating those different receptors in the muscle. The global effects are reduction of acute pain. So going back to Dr. Jason's story, he was in so much pain that he was unable to function as a person. He was unable to do simple tasks like take a shower, sit in bed, sleep, all of those things that we need to essentially function as a human. And he started to find that relief. And so you think about the emotional and mental effect that pain has on a person. We're relieving all of those through the use of percussive therapy. Let's talk a little bit about the device itself. So we're talking about a handheld, easy to use, battery operated percussive device. It's used by sports trainers. They started using it with professional sports teams several years ago, chiropractors and doctors. And then it says, and you, that's you, the massage therapist. Everybody, it's for anybody. The unique triangle, so I'm just going to hold mine up right here so you can see the picture is there, but I don't know if any of you have a Theragun. Maybe just give us a little shout if you already own one, but it is created, Dr. Jason wanted to make sure that you could use Theragun from absolutely any angle that you needed to. So there are different grips inside of here to help you be able to navigate this. I see a little shout out there. To be able to navigate it around any muscle area. So you think about yourself as a massage therapist, the last thing you want to do is compromise your body mechanics. And this is the greatest tool to use because you have to do very, very little effort. I always tell people that I have 2 little girls and they easily use this, and I've done well training them so that they can use it on me. Theragun has over 12 years of experience, and they've gone through several different prototypes to get the best ergonomic design out of it so that, again, you're treating yourself well while you're treating others. So how to use it. We always want to turn the Theragun on before you place it on anybody's body, yourself or other. All you want to do really truthfully is rest the Theragun on a person's body. The weight of the Theragun itself is going to elicit that 16 millimeters of depth, those 2,400 percussions per minute. And it's very, very simple to use. You don't have to grip it tightly. You can just simply float it over the body and it's going to give you the effect that you want. You just move it very slowly depending on what you want to elicit. If you're trying to energize yourself, you want to do quick movements. If we're trying to relax and maybe break some muscle tension, we're going to go a little bit slower in our movements. And then using the Theragun as a massage therapist, it's a great way to explore a person's body and find out where there's tight spots and things that you might want to work on going forward. I'm going to skip over this 365 because it is not necessarily, it's not necessary to know at this point, but the pressure concept, we want to talk a little bit about that. Feeling and understanding how the Theragun's moving over a person's body will help you kind of understand what kind of a pressure you need to apply. You think about the difference between just simply floating over someone's body to try to relax them, and then it helps you kind of read the body. If you've had a Theragun and you've experienced what that's like, you can kind of read through the Theragun. There's a little feedback point that lets you know there's tight areas. And unfortunately, unless you have one, if you have one in your hands, by all means, turn it on and start using it on your body just to try it out. And then if you get one in your hands, try different pressures so that you can see how it feels. It's a fantastic way to just understand that concept of that feedback and understanding applying pressure. We obviously have some contraindications. Many of them are pretty similar to massage therapy itself. We're not going to use above the Adam's apple at this point. Obviously, we're not going to use it on our genitalia, no open wounds or surgery incisions. If a person is healing from the surgery, I always say if the scar is pink, then it's okay to use it. It actually is very, very effective in helping scar tissue break up and helping that healing process. Pregnant women at this point, we're saying not to use it around the abdomen at all. Some spas and hospitality chains have their own contraindication lists. One that we trained recently had decided to just say not to use it at all on any pregnant women. So based on our information, you're able to just kind of make your own determination at that point. Obviously not over the kidneys, same as massage therapy, you wouldn't apply pressure in that area. On or near the bones using the designated attachment. So each Theragun comes with a dampener attachment, which is very soft. It's okay to pass over bones, spine, bony prominences, and it doesn't damage them. It's not going to hurt. It just doesn't feel good, and it's not what it's intended for. So pacemakers, blood pressure medication, any history of embolism, we've said deep vein thrombosis is a contraindication, and most of these we would require them to get some kind of doctor's note saying that it's okay for them to have Theragun. Some of the common faults when using it is applying an incorrect amount of force, using the incorrect speed, and that's the nice thing with the speed range that we have now. You're able to kind of determine what's going to work best for your client. Spending too much time in an area before an activity, which that speaks to our athletes. Using improper grip or arm angle, and starting the treatment directly on the most tender area. You want to kind of work up to it as you would in a regular massage, and then not yet having the attachment perpendicular to the body. So anytime you run it over the body, I'm going to move over, can't see over my black shirt, but you want the attachment to always be perpendicular to the muscle group you're working. So if it's on the side of the body, obviously you want to change your angle and your grip, but the attachment always needs to be perpendicular to the person's body. Okay. So just to recap a little bit with you, our company mission, we're bold, deeply authentic, and driven to provide relief for people with any kind of body pain. Above all, every day we want to make our customers happy and know that we truly care about them. And this really is, I can speak from experience with that, is that Theragun really, really does care. We do care about your education. We care about our people, especially during this time. We care so much about what's going on in the world and helping people to feel better. What a fantastic way to get a massage when you can't go out and get one, right? And then to start practicing it. Theragun University